Let's talk about a couple of things. LIS is low income subsidy, also known as extra help, and it helps low income individuals with drug costs. So if you think you may fall into that category, you can always call the 800 number on the back of your insurance card, like if you're with Humana or Aetna or whoever, and tell them what your income is, and they can check quickly to see if you qualify. The other end of that spectrum is something called Irma. Now, Irma is for high income earners. So it stands for income related monthly adjustment amount. There's always a 2-year look back. So for 2022, they would be looking at your taxes for 2020. If you were single, you could make up to $91,000, or if you're married, filing joint, you could make up to $182,000, and your Part B, as in baby, would just be $170.10, and that's what average American pays. However, should you exceed those thresholds, there is an escalating scale of up to $750,000 or and over, which means if you fall in that category, you're going to probably be paying more like around $500 for your Part B, and then you'd pay a much higher amount for your Part D. Oftentimes people will call me up and say, well, I'm already paying X for my Part D. Well, if your Irma charge is totally different from your monthly premium charge or your deductible or your copays, okay? Irma is just for high income earners only. How do I avoid penalties? Easy. Enroll on time and never disenroll. Okay, so once you become Medicare eligible, unless you go back to work for an employer that has 20 or more employees and offers Medicare equivalent insurance, stay on a plan all the time. Don't disenroll. If you do, you're going to get a penalty. And in the Medicare and You book, in this book, it says penalties are for as long as you have Medicare. How long are you going to have Medicare? As long as you live, right? Okay. So what happens if I'm on a plan and my pharmacy goes out of network? Well, one or two things. Either you'll have to pay the higher cost, or you'll have to find a pharmacy that is in your network. And I know this just happened this year with TRICARE. They decided they were going to go out of love with certain pharmacies. And so should that happen and you go to that pharmacy, you're going to pay a higher cost for your drugs, or you can call TRICARE and find out. Same thing with your insurance. If you find out that you're going to a pharmacy and they're not in the network, then find a pharmacy that is in the network. Okay, so that you don't have to pay that higher amount. The Inflation Reduction Act, that's a mouthful. That's what I was trying to remember earlier, Lauren, when you and I were talking. So the government recently, in the past month, passed a law, and it's called the Inflation Reduction Act. And what that's doing is it's a several year plan, and they're doing it in phases. So this year, in 2021, they're changing. Remember, I don't know if any of you have had shingle shot, but you have to get 2 now, and they're like $200 or more per shot. So starting in 2023 in January, vaccines are going to be zero cost, and they're going to cap insulin at $35. Now, I would like to say certain insulins, because I have been writing plans and I'm noticing not all of them are coming up for $35. Actually, that means nothing, because they just made this effective like a month ago. Well, insurance companies don't turn around that quickly. Okay, there's 60 million Medicare eligibles in this country. So once they make any type of change, it takes a minute. But The Inflation Reduction Act says that insulin's going to be $35 a month. I really doubt it's going to be those that you see advertised on TV, but hey, stay tuned. Me and you both may be pleasantly surprised for this. I hope so anyway. And then the bill states that in 2024, there's going to be a maximum of $3,400 out of pocket. So regardless of what drugs you cost or how many thousands of dollars, supposedly they're putting a cap of $3,400 that will become law in 2024. And then in 2025, they're lowering it to $2,000. They're also saying that year they may allow you to pay like $167 a month instead of coming up with the whole $2,000, say, if you were on a drug. But I don't know how they expect to get blood out of a turnip, because I think if I had to pay $2,000 or any of these prices for my medications, it would be a shock to my finances and to my budget, like most Americans, and especially seniors, because they've worked their whole life. Most of them are on Social Security, and unless you have saved up a nice fat nest egg, these amounts of money are still so astronomical. They can break the bank really, really quickly. Something new that's happened this year is we being agents, have to record all calls between the client and the agents. Now, this is, of course, in direct response to those crazy TV commercials that you see, because it's like reputable agents are being punished as well as the public for those commercials. I like this, and I hope that this will help put some of those folks out of business, and they will revolt some of those insurance agents' license, because they're just predators. Don't ever, 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 ever call an 800 number from a TV. Anything you see on TV, okay? I look at those people as scammers. Whenever you call there, you're usually calling like a call center in a foreign country, somewhere like Pakistan or the Philippines or somewhere. If Americans, think about this, if Americans have a hard time understanding Medicare and drug plans, those people don't know anywhere near what we know. If you decide to use our company, and I'm getting ready to close this down, because I hope that Lori is on board now. We have a very methodical way of handling things. First of all, we have a discovery form that we email out to you. You put all of your information on that. Once we gather that information, your plans are researched and compared to verify even if you need to change. Oftentimes you did good the first time, you just need to stay where you are. If you do, then you have to complete a scope of appointment. That's a form required by the federal government saying that you agree to have a meeting with us for us to talk about that plan specific. We're not going to talk about my vacation or about life insurance. We're going to talk about that specific Medicare plan. Then we'll schedule an appointment, go over our findings, and help you get enrolled in a plan.